first state my appreciation to Linda, National Federation of Families, and all of you for the work that you do with families and young people across this nation. You have to bear with me a little bit this afternoon because I'm feeling a bit emotional. But you're all used to that, right? Not only because of what's happened this past week, of course, but frankly, I couldn't feel a better place to be. Because family for me has been essential for my own journey of recovery. A place of unconditional love, a place of incredible supports, a place where I could turn to when I'm in my darkest moments. And I've lost my clicker. I have to have it somewhere here. It's because I have a hole in my pocket. So let me fish this out. I also want to say, and this is standard for us feds, disclaimer. So anything that I'm saying today are not necessarily the positions or views of the federal government and the U.S. Department of Health and Human Services or the Substance Abuse and Mental Health Services Administration. They are my views and my views only, right? So today I am going to share a little bit about, first of all, my own personal journey of recovery, and then jump into what we're doing presently at the federal level to expand opportunities for hope and healing for individuals, families, and communities impacted by mental health and addictions. So my story begins in the city of Philadelphia, where I grew up, to a family that knew mental health and addictions intimately. My mom, who I consider the heroine of my life, was someone who knew serious mental illness intimately. She was state hospitalized on several occasions during her life, subject to the evidence-based practices of the day, including forced insulin shock treatments. She went on to raise 4 children by herself in fairly abject poverty, went on to get a graduate degree in philosophy, taught for many years at a local community college, nationally published poet and community activist in her own right, and my #1 champion. My dad, who was a Korean War vet, he was also a school psychologist. And he was actually a very good clinician. As a dad, he had his shortcomings. Like many returning servicemen and women, he didn't talk much about his battlefield experiences, but instead dealt with it through the bottle. My earliest memories in my household were the brandishing of weapons, the broken whiskey bottles. And for me, that domestic strife in my household certainly led to my future mental health and addiction issues myself. Feeling unsafe at home, high degrees of anxiety, depression, not knowing if in fact I would be alive the next day. In school in the 3rd grade, not interacting with my fellow peers. Teachers at my school thought they were doing something good. It was like a case of early intervention, what I consider now done wrong perhaps, in that they pulled me out of a classroom in front of my peers to talk to a school psychologist. And again, it wasn't bad talking to that school doc at all, but what struck me the most was the reaction of my peers on the ride school bus home. What's wrong with you? Are you crazy? Are you psycho? Going home to my family, crying my eyes out and saying, there must be something wrong with me. Frankly, That was my first taste of what we've called stigma, the social exclusion, the prejudice, discrimination associated with our conditions. And that turned me away from seeking services for over 20 years. Why would I have anything to do with seeking care if this was the outcome that I was going to face? So going back to school, not getting treatment, like many of us dealing with that incredibly crushing pain and anguish and fear, turning to drugs and alcohol to cope with what I was facing. So as a young person, getting my hands on any substance to dull that pain. Drinking grain alcohol before school. Smoking dope morning, noon, and night. Methamphetamine, cocaine, LSD, you name it, opioids. Also bullied from elementary school all the way up through high school almost on a daily basis because I was different, because I wasn't engaging with my peers. We talk about trauma, we talk about adverse childhood events, right, Dennis? But when we compound those traumas on an ongoing basis, it's so much harder for us. And that was my case. In the hardest days of my addiction, getting hauled away in the back of police cars in handcuffs and arrested and taken to jail. Just another sign of how we criminalize, right? How we criminalize mental health and addictions in this nation. Too many of us in our jails and prisons. Someone said to me, recently that the snake pits that we have today are in our jails and prisons for people. The conditions that people are facing. I don't need to tell you all families this, right? That time of early adulthood, those transition age years, for all of us is the hardest, but particularly for those of us who have mental health and addiction issues, and that was certainly my case, where I couldn't get out of bed for days at a time, where I didn't have a friend in the world, where I didn't have a home of my own, where I didn't have a job, where I didn't have access to health care or behavioral health care. I didn't have a sense of purpose or meaning in my life. Sadly, too many of our youth are at those same circumstances today. So I made a decision on October the 11th, 1985, that I was going to end my life. And I went down to the subway platform in North Philadelphia, and I stood on the ledge like I'm standing on the ledge of this platform as the train was approaching down the tunnel and the light approaching and the rumble of the train as it was coming, ready to take that step, because I didn't see any sense of future in my life, any meaning or purpose. Ready to take that step, and as I was, something pulled me back from that ledge. And what that was the thought of my mom. And I say that because of you, because of the power of what family brings to our lives. And what my loss would mean to her. So I made a decision to try to get some help. I went to the counseling program that was close to that subway stop. Went in, I told them I was in crisis, and they said, come back in 30 days, we have an opening then. And how often do we turn away people, frankly, in need, oftentimes because of the lack of resources, because we continue to be treated as second-class citizens, because of our issues, or continue to be treated as second-class conditions. But what I found in that program changed my life. And I found a sign, it was literally a sign on the door of that program for a job. And it was a job at a local mental health program, staffing an information and referral line, what we call a warm line today. People from across the city with mental health and addiction issues calling, looking for help. And I found three things through that job. I found, first of all, that I wasn't alone, that there were so many of us who experienced these conditions. Second thing I found was that, in fact, recovery was possible, that treatment and services could, in fact, help. That gave me a sense of hope. And the third thing I found was that sense of purpose, that when we help someone else, we also help ourselves. I had value in my life. I found a reason to live. And I dedicated my life and my career ever since then to helping my fellow peers and family members. I went back to school and received a master's degree in social work, graduated summa cum laude, went back to work at that local mental health program. We were involved in Philadelphia at that time, closing Philadelphia State Hospital, AKA Byberry, as it was known, notorious for many years as a snake pit. Every year the state would come in, they would promise reforms, and then a new committee would come in the next year. Governor appointed a blue ribbon commission, came to that hospital. The guard said, "We'll see you back next year." But we were successful in closing that facility, in fact, and moving the resources from that hospital into community services, including diversion services to prevent people from entering the walls of those hospitals. And we used those resources to develop a range of peer and family programs. We operated the first federally funded, in fact, mental health peer support program called Project Oats, Outreach, Advocacy, and Training Services, to use people who had lived experience in former homelessness to do street outreach. We developed a consumer case management project that led to the peer workforce that, in fact, we see today. We developed peer-operated housing and vocational programs, family psychoeducation programs, and much more. In those days, we were very much involved in direct action advocacy, because sometimes you need to take those steps in order to affect change. So one day I found myself chained to the doors of a federal office building in Center City, Philadelphia, protesting around the needs around housing and homelessness in the city. Ended up spending a day in jail as a result of that action. But that resulted in over $6 million also in new funds for housing in the city. And so that was almost 40 years ago. And so now I joke that for the past 30 years, I've been joked inside of a federal office to my desk. Around the same time, I made a decision to move from kind of outside the system to within, and I went and began working for the Philadelphia Office of Mental Health at the time. We worked in programs, HIV, AIDS, and homelessness, and helping move folks who had been long-term institutionalized at another state hospital back into the community. And you know, some folks will stay with you all your lives, and one woman I will never forget. She had slipped on a trolley track in Center City, Philadelphia in post-World War II, hit her head, probably had a case of traumatic brain injury, spent 40 years at that hospital. Last 5 years, she was there, she didn't speak a word. Every day the staff would come, they would lay out her clothes, tell her what food to eat, tell her what TV to watch. We developed a community residential program for her and others, enabling her to live in the community, and every day, right, the staff would come, they would lay out her clothes, tell her what food to eat, what TV to watch. She'd been living there about 6 months. One morning, the staff came in and laid out her clothes. She spoke up, first time in 5 years, and said, "No, I want to wear what I want to wear." Right? And that's what our work is about. Our work is about giving people that voice and choice in their lives, even simple things about what clothes we're going to wear on a given day. Around that time was the time that SAMHSA was, in fact, established in 1992. And you know, our agency, as you all know, long history of supporting peer and family voice. Every year through the community support program, right, we'd have a learning community conference kind of like this, but it would include a track for peers and families. One year, because of political pressure, they decided not to have that particular track. And people weren't happy about that. And this conference was held a few blocks from where SAMHSA's headquarters was. Now we're back in that building. People took matters in their own hands, and they walked from that conference to SAMHSA's headquarters and staged that. Back then, it was before the tragic Oklahoma City bombing, where you could walk into any federal facility. And those people staged a sit-in in the offices of the Center for Mental Health Services director then, Dr. Bernie Ahrens. Thank you for that clap for Bernie. He's one of my champions and mentors. Bernie met with those folks, and he issued a letter that I still have in my office today, where he promised that he was going to hire someone to come work at the agency to work on peer and family issues. And I was hired ultimately for that position. And if it wasn't for the actions of those individuals on that day, I wouldn't be standing here in front of you today. So we always acknowledge those giants that have come before us. Bernie's special assistant at the time, and she told me this years later, and she always says, "Tell them I'm a nurse." She had pictured me coming in as this first ex-patient, working at the agency, stereotypical that I'd be drooling at the mouth and shuffling. And she had decided that it was going to be her job to take care of me. Long story short, 3 years later, we were married. And 27 years later, we do take care of each other, Dennis, and our 3 now young adult children ourselves. And, I share that because of there is such power when we do disclose. When we are public with our issues, we see people as people and not the labels, right, Dana, that we put upon each other. And that's not saying that you have to get married, right, to other people. Some of us do, right, Carol? But interpersonal contact is known. Science has proven this out to be the most effective way, in fact, of reducing stigma and discrimination. Long story short, I ended up ultimately becoming the director of the Center for Mental Health Services. So I found myself in that seat where people staged that sit-in so many years before. Today, I was, again, first self-identified, right? Person with lived experience to work at the agency in 1995. We did a survey of our staff last year, and We now have a staff of about 900 people in the agency. Fully 20% of those staff identify as either people with lived experience, including people in recovery and family members. That means going from one person to over 200 at the federal level. And that really is progress, folks, right? We know at the federal level, of course, we go through changes in leadership and administrations. And we're getting ready for another one. But we've been through this before, and I mean, that's the life of a federal employee. Because our dedication ultimately is to serving the public. But I'll say, new leadership always wants their leadership, so I found myself in a different role. Our current administration, under the leadership of Dr. Miriam Delphin Rittman, who talk about champion for recovery and peers and families. In Dr. Delphin Rittman, we've had one, and I want to really acknowledge her leadership over these past 4 years. And I found myself appointed a bit over 2 years ago as the director of our Office of Recovery, the first ever, in fact, Office of Recovery at SAMHSA. So I'm going to come back to my story at the end just for a moment, but let me just say this, that I'm going to talk more about what we're doing here at SAMHSA. Of course, our strategic plan includes recovery, excuse me, as you can see at the bottom of the slide, as one of our key principles moving forward. You all know this very well in terms of how we define recovery. And the way we define recovery, and this was through a consensus process, people with mental health and addictions issues and family members, as a journey, as a process for people really to improve three things. First is their health and behavioral health. The second is to be more independent, to be self-determining, to be autonomous. And the third goal is to pursue your full potential. So I know one of the debates, certainly, and I've been part of it, right, is does recovery apply to youth, right, in the family context? And I'll go there here. If you look at these concepts, right, promoting better health and behavioral health, to me, being more independent, to pursuing your full potential, that's across the age lifespan, right? From youth all the way up to older adults. You know, I like to joke also that my back of my bumper sticker, it says recovery is patriotic, because if you look at these concepts of health, self-direction, full potential, what we're talking about here is life, liberty, and the pursuit of happiness. Our fundamental American principles and values. We also identify, of course, these four things that really support a life in recovery: health, home, purpose, and community. So health, having access to affordable and high quality behavioral health and health care. Second, health, home is having a stable place to live, a place of solace where you can come home at night and lay your head down in a place that's safe. You know, one thing through all the decades of data that we've collected in research, housing, number one, in terms of reducing mental health symptoms, reducing addictions, reducing criminal justice involvement, improving employment outcomes. And yet, today, of course, we have an affordable housing crisis in nearly every community across this nation. The last count from HUD this past year showed on any given day, 650,000 Americans, 650,000 Americans, largest number ever, living in our streets and shelters. Health home, the third thing we discuss is important in supporting a life in recovery, is purpose, including employment, including education, including other creative pursuits and volunteering and spiritual beliefs. And finally, I jump back there a little bit. Health, home, purpose, and finally, community. Again, peers, family members, community members. We know, again, protective factors that enable us to thrive. Health, home, purpose, and community, the building blocks of recovery. Everyone's familiar with NSDA, I hope? We love our acronyms in government, right? NSDA is the National Survey of Drug Use and Health. This is SAMHSA's #1 survey that we conduct over 60,000 households every year and ask them questions about mental health and addictions. One of the questions we ask them is, are you in recovery? First time ever we produced last year this report. These are the findings. It shows that, not surprisingly, recovery is common. There are many of us, and it should be, in fact, the expectation of everyone who experiences a mental health and addiction concern. Check this data out. Over 60 million of us identify as being in recovery in this country. And that translates into over 70% of folks who've had a mental health or addiction issue. We're looking, in fact, to improve it. You see that little footnote on here that NSDA only collects data from ages 12 and up. So we are looking at modifying this in the future so that we can better collect data for families and youth. Again, under Miriam Delphin Rittman's leadership, we established, and let me just also shout out Tom Coder. Can't mention Tom here as well. Our Principal Deputy Assistant Secretary in the center in front with me here, and he is also identifies as a long-term leader in the recovery movement as a person in long-term recovery. First ever acting SAMHSA leader, in fact, in recovery. This is our team. So let me shout out here. First of all, Donna Dimitrovic. Donna, could you stand up, please? I'll put you on the spot. An incredible leader in recovery and recovery communities for many years. And Carol Cecil. Carol, please. Yeah. Carol, known to so many of you as former Kentucky family lead. Also have to shout out, of course, Liz Sweet. And all respects and propers to Liz, our former family lead as well. But our team here encompasses right now, we grew from a handful to now we have 15 FTEs. Almost all of us are people with lived experience, people in recovery and family members doing this work. And we've identified in consultation with families and people in recovery this national recovery agenda. Our overall goal is ways of advancing recovery, hope, and healing across the nation. And doing this with people in recovery, families, and communities to pursue recovery, build resilience, and achieve wellness. We've identified here these 5 overall goals. I'm going to talk briefly about each of these and what we're doing in these areas. 5 goals are inclusion, equity, peer services, social determinants, and wellness. Before I do that, though, really believe in what's the most important in terms of leadership is to be principled in the values that we operate from. And so we've identified these set of principles. These are, in fact, principles, if you look at these, that come right from our recovery definition. The importance of hope, of person and family driven, that there are many pathways, that my journey of recovery is unique and may not be the same as anyone else. Then the importance of whole health and holistic supports, the importance of peer and family supports that ultimately this is about relationships with each other. The importance of culture. You know, I talked about my own journey and the importance of family, and as a proud Italian American, familia is like critical around the dinner table, right? Importance of addressing trauma, and as my own story, and again, I'm not unique there, right? We know the adverse childhood events. In fact, let me just say a word, I'm going to come back to trauma. This week, 3 studies published in JAMA, the Journal of the American Medical Association, linking trauma to the development of mental health and addiction issues. We now have a firm scientific basis that trauma leads to these conditions, and we know even the physiological steps that lead to these conditions, right, Dennis, from trauma. So the importance for us to adjust trauma and to prevent trauma, frankly, from occurring in the first place. The importance of building on our strengths and responsibilities. CASP principle here, right? And the importance ultimately of respect and dignity for us all. So back to our goals, the first of inclusion, nothing about us without us. The need to meaningfully involve people with lived experience and family members in all we do at the federal level and at SAMHSA. And what we did here, first of all, was establish a formal SAMHSA policy to set the expectation that peers and families will be involved in all that we do. In our grants and contracts, so we put language, standard language, in all of our grant announcements. In the meetings that we convene, in our communications, in our evaluation and data connections. In issuing this guidance, we also are doing look internally about measuring how successful we're doing here. We've also seen other agencies begin to adopt this. We really believe at the federal level we need to model these practices so others can follow. You know, I noted that we now have 200 people with lived experience in the agency. Exciting thing this past year is that we established an employee resource group for people with lived experience at the agency, for peers and family members, to help SAMHSA, in fact, become a recovery-ready workplace ourselves. So that's a really exciting development that we just announced just this past September for Recovery Month, in fact. And speaking of Recovery Month, and shout out here again, Federation, for all the partnership and so much, particularly with our support around efforts around Recovery Month. September every year we celebrated what was done 35 years this past September of Recovery Month, and a whole series of activities, including our second National Walk on the Mall that's pictured on this slide, where we walked from Freedom Plaza, 1 block from the White House, to the Washington Monument, where we rallied, and we had hundreds of people, as you can see in this image here today, joining us to celebrate recovery, celebrate people with lived experience, peers, and family members. We also know, the importance of children's mental health awareness and acceptance. Okay, hey, we listen and we learn, right? And again, a shout out to Liz Sweet here, because her leadership, and particularly in 2023, with a whole series of training activities for children's mental health acceptance. Our second overall goal is around equity and the importance of recovery for all. And we know the underserved and under-resourced populations, like people of color, LGBTQI+, like women and girls, older adults, rural populations, veterans, do not have equal access to care and recovery supports. So the importance for us to particularly focus on addressing those disparities, in fact, in recovery for all. One of the things we did in support of this overall goal was, first time ever, a tribal recovery summit meeting last summer that we convened in Dallas, Texas, that included over 300 tribal members from across the nation, and they told us about and I know we have tribal members here with us today. They told us about the incredible experience, the high rates of suicide and overdose death in tribal nations, but they also told us about the indigenous culturally based healing practices of sweat lodges and drum circles and much more that help people find that hope and healing in that important cultural community context. As a result of this particular gathering, we developed a centralized web portal on recovery resources for tribal members on our website. We also, this past year, under Donna's leadership, I'll say as well, convened the first ever also technical expert panel looking at recovery in LGBTQI plus communities. And, we know the incredible needs that LGBTQI plus populations have across this nation, and the need, again, to provide tailored supports and peer support opportunities and more for LGBTQI plus populations. If we talk about trauma, now and what's to come, the ongoing importance of us focusing here. Our third overall goal is around peer services and peers helping peers, including family peer support. President Biden, in one of his acts during his administration, developed a unity agenda, and one of the things as part of that unity agenda was a call for us to develop national model standards on peer support certification. This is a landmark because this is the first time ever that highest level of government, President of the United States, in fact, acknowledging the value of peer support. So in June of 23, we issued these national model standards. These were developed with peers and family members. It was designed, in fact, to promote uniformity in how states currently certify and train the peer workforce. Because right now, state to state does it differently, right? How Florida does it, if you cross the border to Georgia, Alabama, completely different. You can't take your peer certification, right, Dana, across the state lines in so many places. So this particular set of national model standards was meant to promote that uniformity and improve the quality also of the peer workforce across the country. In the wake of these national model standards, we've seen a number of states begin to adapt their certification standards. We've seen places like Puerto Rico who are beginning to develop their certification process using our model standards as the guide. And we've seen for the first time ever private insurers taking our national model standards and adopting them to provide peer support services as a covered benefit in the private health insurance market. That's progress, folks. Recently, through our Peer Recovery Center of Excellence, we did a survey of states to count the number of certified peers. This doesn't mean, again, that all these folks are working right now, right? But these are the number of folks that have been, in fact, certified. A previous estimate about a decade ago said about 30,000. This most recent that we just released, over 81,000 certified peers across the nation. I asked our staff to compare this to the other behavioral health workforce across the nation. Right now, we're number 3. So behind counselors and behind social workers, peer workforce. Incredible growth that we're seeing in the peer and family workforce across the nation. Peers working not only in treatment settings and in hospital settings, community and inpatient, but behind bars, in jails and prisons. We had a conversation with the Federal Bureau of Prisons a week ago where they're planning on scaling up peer support across their facilities across the nation. That's progress, folks. In support of this goal, we've convened the last 2 years of Peer Workforce Summit meeting. This particular year, we focused on issues of diversity among the peer workforce, because we also know that through studies that peer workforce so far, primarily Caucasian and primarily women. So we need to do a much better job of diversifying the peer workforce. We also convened under Carol's leadership this past summer a particular technical expert panel looking at family peer support and broadening the definition here, not just parents. We don't want to, never, right? We're never going to lose the importance of parents. Being a parent myself, all of my kids have experienced, particularly through COVID, issues of mental health. But broadening it to include other roles like parents and spouses, siblings and child, and we're getting ready to issue some guidance. Stay tuned for that coming out in the near future. Our fourth overall goal is around social determinants of recovery. I'm going to go a little bit quicker here because I just got the sign. And again, we know that these are really critical. Again, whole health care, right? So one of the things, again, under Donna's leadership, recovery housing, happening across the nation. We issued a set of best practices on recovery housing. We convened the last year an interdepartmental work group with HUD and others on recovery housing, and convened Housing First and Recovery Housing Dialogue. I mentioned measurement earlier. This for me is really exciting what you can do sometimes at the federal level. And Dennis, you'd be really interested in this. We're changing our grant reporting requirements. So SAMHSA's grant reporting requirements are really challenging for many. Those of you who are Family Network grantees know all about that, right? And so we're looking at simplifying them and making them more meaningful, where we've included in the proposed new measures a measure of recovery in itself. So this measure takes the dimensions of recovery where people can self-report, as well as quality of life, issues of empowerment. And we're hoping to be able to include that in the next. If we're able to get this measure of recovery out there, this will be a first as well, first ever federal measure of recovery. Also, this is really critically important as we across healthcare move to a value-based purchasing approaches, right? Where people aren't paid just for units of service, but paid for outcomes of care. So having a measure of recovery is critical for us to do that. I mentioned trauma earlier. We've done a lot of work recently because we've seen this, 988 everyone knows about, right? An incredible focus on crisis services improvements. One of the things we're really excited about is the development of respite programs across the nation. So we have a major report that we're coming out with in 2 weeks on peer crisis respites and financing. We have a webinar on November 21st, in fact. You can sign up for right now. We had a technical expert panel this past summer that included family and peer respite programs. This afternoon, we're excited to visit family respite program right here. We know when people come for help, we don't want to harm them, and seclusion restraint is one means where we can really re-traumatize folks. We've seen in this, we've had progress here, right? We've had hospital settings and federal regulations, and that's one of my proud accomplishments over the last 30 years, has been involved in some of that. But we still know this stuff happens too often in psych residential treatment settings. Far too often. Congressional reports this past summer highlighting the abuses and neglect within those settings. Also, of course, schools. We're yet to see any federal regulations. A number of states have employed, as you know, and you guys have been in the forefront of this. Too many of our youth with mental health issues and addiction issues getting locked up behind our school doors. We're coming out also this year with an innovation challenge that's focused on trauma-informed community reentry, folks leaving correctional settings. We know that's of critical importance because the high rates of trauma, folks, when you're in jail and prison, trauma in and of itself. So that leads to issues around rights protections, the importance of Olmstead enforcement of the Americans with Disabilities Act. We've seen our Department of Justice this year, several focused efforts on children's services in states. We've also seen this past year increasing proposals to expand involuntary treatment approaches in a number of states, in part to address concerns about homelessness for both mental health and addictions, I'll say. One of the things we don't know is how often involuntary treatment occurs. There is no standard state or national data reporting on involuntary treatment. If we're undertaking these interventions to deprive people of their liberty, we should at least know how often we're doing it. Shout out to Florida. Not often giving shout outs to Florida, right, Donna? Florida, in the tragic wake of the school shooting in the McDonnell Douglas, shooting, saw an increase in school teacher referrals for involuntary treatment. And because of advocacy, we also saw large numbers of Black youth in particular that were referred for involuntary treatment in Florida during that time. And because of the advocacy of families and others, legislation was passed to help improve that situation, including a real-time dashboard where folks can go and track right now on any time the number of people that are involuntarily treated by age and race. So Florida leads there, but across the nation we don't know, so we're undertaking a study right now to identify those gaps. Hope to release that in the next year as well, and we've had a particular focus on advanced directives. Our last goal is around wellness. We know we die way too young than the general population. Average life expectancy for those of us with serious mental illness and addictions is in the late 50s. I'm 62 this year, so I've passed that actuarial projection. I should be dead right now. Last time the US as a whole had that life expectancy was in the 1920s. So for those of us with mental health and addiction issues, we haven't seen any progress in our longevity in over a decade. This summer, we sponsored, again, through Donna's leadership, a Wellness in the Workplace Summit, focusing on how employers, a lot of interest, particularly coming out of COVID, because it's for employers' bottom lines to invest in the mental health of their workforce, developing recovery-friendly workplaces, including peer and family supports on the job. We also initiated this past year a new effort around art and recovery, and we know for many of us, creative pursuits, and myself, amateur guitarist. I love to sculpt too, but that provides meaning and purpose to my life. We developed an effort this year for both youth and adults to submit their creative works and depictions of recovery. We got over 300 submissions. These are a few examples. It's available on what we call a Gallery of Hope on our website. Check it out. I'm going to skip over the next few slides because you all know the data here about the huge needs among our nation's youth in terms of mental health issues in particular coming through COVID. You also know many of the technical assistance supports, and we've done other things like in September under Carol's leadership, a youth summit meeting. Of course, all the state network grants, the systems of care grants, Project Aware grants, healthy transitions, our youth and family tree grants on the substance use side. This coming year, just as a preview, we're going to be convening 2 focused technical expert panels, one on adolescence and recovery. We're thinking of a particular focus here on youth peer support because we're seeing a significant increase in looking at how youth and students can support other youth. particularly in school settings. And another meeting focused on family caregiving that we love your feedback on, right, Carol? See Carol here. If you have ideas, we have a couple ideas of what to focus this on. Should we continue the discussion around family support? Should we focus on looking at measurement around family and youth? Should we look at, we're also revising recovery-oriented systems of care at a model. Should we look at that as a focus? So see Carol for a focus on that. You all know about this, so I'm not going to say anything more about that. Thank you, Federation. We also have several other resources I'll highlight here. This Peer Recovery Center of Excellence. The website there has an incredible amount of resources. That grant just ended, and we are standing up. We just awarded a new program called the Center for Addiction Recovery Supports that will build on that work of the Peer Recovery Center of Excellence. Some of the work there include a particular focus on youth, so collegiate recovery and recovery high school models. We're providing assistance to the Association for Recovery in Higher Education and the Association for Recovery Schools to expand collegiate recovery and recovery high schools across the nation. We also stood up this past year SPARK, SAMHSA's program to advance recovery knowledge. See Livia and other folks in our exhibit hall to find more about SPARK. It's all about providing technical assistance to family and peer support organizations with a particular focus on equity. Last thing I'll note here is around a new effort for Recovery Month, which was an awards program that we sponsored in September at the U.S. Department of Health and Human Services headquarters called our STAR Awards. And we love our acronyms, right? And this one, there's the SAMHSA Trailblazers in Advancing Recovery. I'll note here several family members acknowledged, as well as people in recovery. I'll note on the far right side is Eve Bird. She accepted the award on behalf of former First Lady, posthumous award for Rosalind Carter for her caregiving expertise in what she's had done around caregiving in particular. These are a bunch of other resources. I'll end here by saying just two things, and I got the word here that I'm over time. One is back to my own story. So as that young person, right, on that subway platform, without a health care, without a home of my own, without a job, without a friend in the world, to now, almost 40 years later, as a federal employee, I have access to the best health care. We have 30 different options, health insurance plans that we can choose from, including parity for behavioral health care. Health, home. My wife, we own a large home in suburban DC, large mortgage, I'll say as well, but a place where I can go and get solace after a hard day. Health, home, purpose. I have a job for the past 30 years that's been incredibly rewarding and a sense of meaning and provides a nice income. Health, home, purpose, and finally community. Having peers, having community members, and most importantly, having family around me. Health, home, purpose, and community, yeah, that's been for me, but what we want that is for every youth, for every family member across this nation. My last word is speak out. Over the last 30 years and even before that, one incredible lesson is that the squeaky wheel really does get the grease. And Frederick Douglass's quote that power doesn't concede unless there's demand is so true, and that the need for family voice today and in the coming days will be incredibly important. And so I commend you for raising your voices and continuing to make your voices heard in so many halls of power. Thank you all so much. Good luck with the rest of your conference. Thank you.
Thank you. I'm sure you can understand why I enjoy working with Paolo so much.